I'm Jen Funderburk. I'm one of the members of the Research and Evaluation Committee Leadership Council, and I'm going to be introducing our speaker today, as well as this webinar for today. We're really excited to have everyone here, those of you who are willing to take time out of your very busy schedules, but also I know many people who couldn't do it during this time will probably watch the recording that will be shared online on CFHA later. So today we're going to be talking about how do CFHA's organizational members support continued learning, translating research into practice, and conducting program evaluation. Many people may not realize, it depends on kind of your background, but there are different types of memberships in CFHA, one of which is an organizational member, where you get a group of providers or individuals in your organization to a group price, basically. And we're getting more and more of those memberships across time, and we thought this would be an interesting topic to explore. A really great presenter to speak for the first 20 minutes and share with us about their experiences within their organizations of promoting research and program evaluation across their organization. And then we'll have some questions, and then I'll help lead a discussion about how we within CFHA can assist organizational members and others in kind of doing this within your own organizations. And are there ways that the Research and Evaluation Committee can provide some support? Is this a topic that interests members? And if not, that's okay too. And are there specific things we could do within our committee to help? This is all an effort to help us with our strategic planning and continuing to be in line with what the members' wants and needs are. So that was a long introduction, but Virna Little has agreed to us from Concert Health, has agreed to be our presenter today and lead us through this initial part of the discussion of how she, within her organization and others in her leadership, work towards encouraging research and the program evaluation and evidence-based practices. So I'm going to let her give you some background about herself and kind of herself in this role, and let her take it away. So thank you so much.
Great. So good afternoon. Glad to be here. Really excited to have some discussion, because I think I'm a psychologist and a social worker, and over the years, I would say earlier in my career, I was not an embracer of research. And I think I felt like how many people in the field feel, and learned over the years that it is really so incredible to have a formal way to be able to just answer practice questions. And I think that's been the most helpful, is to really just start to understand how to create a culture and a way for people to really get excited and participate in research. So I'm really glad to be here. I'm the co-founder and chief clinical person for Concert Health. We're a behavioral health medical group that serves 18 states now, providing collaborative care and partnering with primary care, women's health, and pediatric practices. I'm gonna let our research partner and one of their key folks, Brandon, introduce himself. I thought it would be fun to hear from him today and give people an opportunity to ask questions.
Yeah, thanks, Virna. My name is Brandon Green. I co-own JG Research and Evaluation, which is based in Bozeman, Montana. And the last CFHA meeting was pretty useful for us. We had sort of some connections with Virna through some colleagues, but then drank like a lot of the really expensive coffee from around the corner, and started to talk about what it would look like for us as an external entity that has expertise in integrated behavioral health and collaborative care to start to partner with Virna's group. And so we've been doing that for the last 6 months or so, and it's been going really great.
Wow. Yeah, you know, I actually forgot that second discussion happened at CFHA. So that's a great call out. Thank you. So talking a little bit about what we're hoping to talk about today, really engaging staff, and some of the things that we've done, really engaging staff to be sort of inquisitive and create a culture where people are always asking questions. How can we do this better? What would better look like? I wonder if this would be better than that. And that really, I think, has been a shift for me as a manager over the years, that I've learned to say, well, it sounds to me like, there's a question, and helping people isolate the question even in a meeting. Or what do we think might work better? Like really asking some broad questions. And I think, if you sit in on different meetings, you can really see the difference for those where people are really being innovative and solving problems and asking questions. And I was at a meeting recently, and someone literally said, like, I wonder if patients who are experiencing grief get, adjustment disorder. And like, we're not doing anything about the grief. Like, are people using adjustment disorder appropriately? And if they're not, like, what are we missing that's not getting treated? And that was from a clinician on our team. And so that has actually started off and is now a research project. And really giving people exposure to research. And I think that's a really important piece, because we know that a lot of people in the field don't actually have any exposure to research. They don't read it. Many of them are not in any journals. I remember one time I did this thing where I would give staff like free membership to research journals. And literally nobody took us up on that. And it was really interesting to me to sort of hear what some of the clinicians thought. So we changed that, and we actually just started sharing out information similar to what CFHA does with that little, research bulletin, because I think many of them are really intimidated. They don't actually understand some of the tables and the analysis. And I think it's often helpful to be able to do some training or to talk about it jointly. And then also sharing some case examples, like some stories from the field or case examples at staff meetings. So like, hey, these kinds of things are in journals as well, and reviewing them. So this is what just came out in the field. How should we incorporate this? What does this look like? What do people think about this research? What would be the best way for us to disseminate this? And then taking that to really inform some policy changes. And I think that's the important piece, is that, are you sharing relevant research for what you're doing, and then transitioning to say, how does this change what we do? Does this change our documentation templates? What happens in supervision? Questions that we're asking, so that people really see the loop being closed. Oh, this how it comes from here into practice. And I think that's super important to do. We also started to do some things that, like, research sort of informs practice. So as we made some policy changes, right, then here's why we're making some of those changes. Here's the research that supports some of those changes. And this happened to be around some of our suicide safer care work. And so this was really helpful. And then we did a second page with all of the articles and some bullets from the information. But I think oftentimes when we change something, we don't necessarily give people the research to support it. And I think what that starts to do, that if you do that, what it starts to do is to make the connection between what the research is and what people are doing in practice, and some of the organizational decisions. Like, I didn't wake up on Tuesday and decide that all of you should ask this question, right? That it actually came out of what's happening in the field and as a result of the research. And a lot of times, if you just share it or bullets from it and then ask people, how do you think we should incorporate this information? Should this change anything that we're doing? You kind of get there without having it to be sort of top down. People kind of come to it themselves. And I think oftentimes, as we're talking about some of the research, we come up with more questions. Brandon can attest to this, that sometimes we're talking about something and we're like, oh, that's another article, or that's another question, or that's something else to drill down. So oftentimes just having the discussions leads, but doing a document like this that's really sharing the research that supports some of the decisions is really helpful. And then I think giving, the support, not that, everybody might look everything up, but making it available to them and letting them know, sort of where you got it. There's a lot of talk about tying research into quality initiatives. And I really love that idea, particularly if you can put the infrastructure in. And oftentimes doing the quality projects, it's I find myself giving the most feedback around what is the actual question or problem you're trying to solve, and really isolating that out. And oftentimes that's really good preparation for, like, what is your research question, right? And, what do I really want to know? Like, what am I trying to solve for? And then really thinking about, well, what are we actually, why do we want to know this? Like, what are we going to do with it? What's going to change, right? And then what is our hypothesis? What do you think our answers are going to be? And then getting some excitement around the process, like really trying to figure out, well, who thinks it's going to be this, or who thinks it's going to be that? And then having everybody review their literature together. So oftentimes when we're doing quality projects, we don't tie that into a lit search. So if I'm doing a quality project and I want to know if patients that we call the day before an appointment are more likely to come in, like as an example, then is there research out there on that? And if so, what is it and what does it say? And so many times just even folding in a lit search as part of that quality selection process is really helpful. And it gets people used to looking at their literature and understanding some of those pieces before they do it. And so really thinking about what that looks like. Has anyone else asked this question? And if so, what did they learn, right? Maybe we can save ourselves some learning or save ourselves some doing. So that's often super helpful for people. So like an example of a quality, project that came through, we did something where patients that got a text to reschedule, are more likely to miss an appointment, one of our clinicians said. And so we said, well, tell me more. Like, what are you actually, saying? What does that sound like? And so are patients who get the reminder more likely to reschedule was the question. And then we kept narrowing it down. So are patients who get the reminder more likely to miss an appointment via rescheduling? And so are text reminders effective in increasing show rates for appointments, right? So in other words, is that helpful? That was the problem we were trying to solve with doing some of the text reminders. So how can we know this, right? So how can we look who got a text reminder, who kept an appointment, who rescheduled an appointment, right? And then I always like to ask, what makes this more complicated, right? Was this for adolescents? What about if this is, people who are in certain practices or a certain time of the year, right? And so really thinking about what our baseline is, right? So we don't know if this actually affected things unless we had a baseline. So I oftentimes find the most common problem with like a quality project or something that might be research is we don't actually know our baseline. I want to make this better. Well, we think it's a problem, but how do we know where we are now? Like, we're not going to know we're getting better unless we know where we are now. And a lot of times when I look at the quality projects, they're not clear in terms of having very specific information about where we are now to know whether or not it got better. So I'm going to have Brandon chime in here also, because he certainly has some good tips and tricks around literature searches and what are some of the best places and what's too old. We always tell people 2 or 3 years now is really too old. So Brandon, I'm going to turn it over to you for a moment and maybe just talk a little bit about some best practices that your team has that you've been able to share with people.
Yeah, and it was one of the things that I was thinking about while you were talking, Virna, because if you're a medical system or you're folks who are not directly connected to a university, access to databases that pull together peer-reviewed literature is kind of limited or challenged. So Google Scholar, I find to be pretty useful. I think the push towards more and more open access journals has been useful. We use a service called Deep Dive, which is a pretty low cost subscription that's really intended for organizations who want access to journals that would be behind paywalls or firewalls but don't have a university partner. And then I think that the third strategy, and my guess is this will come up in the conversation later as like one of the key roles the research group at CFHA can play, is partnering with academic institutions and working with grad students or other individuals who may be able to find articles that maybe a site has identified they can't get access to through an open access resource. And then I think the fourth strategy, ResearchGate, is a kind of mechanism for doing this. But I don't know, academics who write stuff are always so happy for someone to just write them an email and say, hey, I came across this article, would you mind passing it along? And so I think whether or not one has connections to a university, I think there are lots and lots of ways to get the bulk of the content through some of those approaches.
I know we found it helpful. We do something called Unbound, and it's like $1,500 for the whole organization for the year. And everybody gets access to journals, and it has like some diagnostic decision trees that clinicians can do from their phone or their computers. So I think some of those things are also really, really helpful. There was talk a little bit, Brandon, about program evaluation and wondering about, where to start with program evaluation and what some of your tips might be for people, just coming in, or tips that CFHA could even start to engage, organizations around.
Yeah, I mean, I think you touched upon some of the things I was thinking about, like in our collaboration. I feel like as the researcher, often what we're doing is helping to structure the thinking so that it can move toward a publication. I think the same thing is true with program evaluation, right? I mean, we often, other evaluators, it's a sort of the ideal that you get to work with a site at the beginning of a project to create a logic model and a plan and outcomes. But often it doesn't happen that way. And so I think some of the roles that the research group can play, just working with sites when they get a new grant, or they want to start a new quality initiative, or they want to start a new program, thinking through where the data might be that could hold some of the baseline information. And then we tend to spend a lot of time in the context of evaluations working with sites to think about how their data processes and their flows internal to like what they're already doing with slight adjustments could generate the type of information required for an evaluation. And often, in my observation, sometimes that little piece gets overlooked. The assumption is like, well, we're collecting a lot of data and it's there, so we should be good. But making sure folks build in a very specific time to look at data collection processes and workflows so that there's clarity to make sure the information needed is being collected. I don't know, those are kind of the main things.
Mm-hmm. I also realized, to talk a little bit about the partnership. So one of the things, that at Concert Health, we knew that we really wanted to, do some peer-reviewed publications, but also even just some blogs and some white papers, and be able to write about, some things, some case examples, and really wanted to try to have, to me, it was more about having a thought partner as much as a research partner, to really take through the process, to think about what do we really want to know, what's going to be the most effective way to say it or show it. And so I think that was a real place that I thought was going to be super important. Someone that could have conversations, would not be intimidating for staff, that could really just take people through the process. And so I would encourage people that if you don't have the internal resources to do that, you find a thought partner like Brandon's team or someone else to really help in some of the processes, because it really is incredibly helpful. And I think it is helpful in terms of being able to do more official work and to start just writing. Like, we have staff that have, blogs. We're putting some blogs out on our websites. We're putting some different posts, stories from the field. Oftentimes, I've had several staff people that have put out a blog or stories from the field. They love to do this work. They love to tell about the work that they've done with a patient. And that really, like, from a retention standpoint, from, sort of a morale, telling your story to the world, it is really invaluable. The staff absolutely love to do it, and really the fact that they were able to get published, and it's really a nice bridge for them to maybe do some other work, to really calling out potential research questions. And I say all the time, that's a fabulous question. That would be a great research project. And then I act on it. Then I actually set up a time with that person to drill down the question. Would this be a good quality project? What do we want to know? How could we know it? So there's like almost an immediate action to that. And then they get added onto a spreadsheet, and, you know, we get Brandon's team involved, and that's regardless of how it winds up. Let's just be thought partners in drilling it down so that we know like what exactly is our question. And I know there's a lot of sort of sayings like this. I saw one the other day that I almost liked better. But I always tell people, like, the worst idea on paper is better than the best idea in your head. Like, it doesn't matter. Just put it down on paper, whether it's in one long sentence or whether it's in bullets or it's some sort of a brain dump, because then we can talk about it. We can move it around. We can add information. And once people get there, then that's actually really helpful. And I say, just don't even think about anything else. Don't think about any writing requirements. Don't think about anything. Just do a brain dump. And that's been really helpful for staff people. And then they've actually been able to say to other people, no, she really does mean do a brain dump. Like, she really does mean do one long paragraph. And that's how I started. And it was totally cool and it was fine. And then also give people time to be able to do that. You know what, we're going to block you for, 20 minutes, 30 minutes later today, so that you can do that brain dump, so that there's actually some support to be able to do some of these activities. And that's a really important piece, that you kind of have to have the infrastructure around doing that. So I know we went a little bit over time. I will own that. Sorry about that.
I wanted to just add
Yes.
David's comment in the chat about statistics. Like, that's been one of our roles as the project partner, is really how do we take a technical mathematical process and explain it to someone whose expertise is taking care of someone, or being a clinician, and thinking about the disengagement paper that we're working on, right? One of Virna's staff went through the process she just articulated, was very nervous about research, and came to our first conversation as like, I don't know anything, but I kind of want to know why people disengage from care. I was like, oh, okay, great. We can work with that. And we can kind of like start to tease out, what type of data do you have? We kind of felt like it was our responsibility as researchers to be able to explain the methods in ways that were accessible and clear. I think it helped to like make it less intimidating, because it started to be really obvious, like, oh, sure, she can't do the math necessarily, but she can understand what it is, and it helps her understand the things she was seeing in her practice setting. So I do feel like it's kind of on the responsibility of research partners to be able to explain things in ways that are accessible to folks who have different types of expertise.
And I really like the comment in the chat too. Like, I could look at it, but I don't know enough about some of the analysis to know if it's even good research, right? Like, that it's even, or where some of the problems might be, or to even explain it. And I think that's a really important point. And I know that I find myself in that spot all the time. And Brandon's team can attest. Sometimes they'll send things and I would say, that's great, except I have zero idea like what that is. Like, I need you to just talk, walk me through that. And I think one of the things that might be helpful to your team members, to CFHA, is to actually have people bring articles and talk them through some of the analysis, or maybe go through some of the different kinds and sort of put them in English in a way that people could, take a cheat sheet away from. I think would be a really helpful CFHA conference activity, to be honest, where people, because one of the things that I look for in a partner was a place of comfort where, people could ask questions and say, like, I literally don't understand that. And, talk me through it, walk me through it. Why are we doing it this way? And I think that might create a nice space for people to do that.
Well, thank you both. This was a good introduction to the discussion. I think let's take a few minutes to kind of allow for questions. I know I had one or two that I wanted to make sure that I got to ask before we move into the more discussion element of CFHA. I'm really appreciative you've already started. I took some notes of several strategies that we could consider. But first, are there any questions to Virna or Brandon about kind of what they presented on and just more specifics about what they presented first? We'll give 5 minutes, 5 to 10 minutes for that, because I know I at least had some, and Bill is raising his hand. So
in the old fashioned way, I'm not sure why I'm doing it that way, but no, really appreciated the thoughts, your experience with this. I have two maybe big questions. So let me just not do what I usually do and ask them at the same time. The first one is, you spoke, and I really liked your ideas about how to garner some enthusiasm from, clinical staff about contributing to this, certainly building it off of QI ideas and principles. I guess I'd like to hear more from your perspectives. Where really is the value, or what are the incentives for leadership, for the clinic leadership's administration? QI is obvious, that has local value, but what's the value for these clinics to go from local QI to actually publishing it as a research article?
So I think publishing, whether it's peer-reviewed case studies, I think there's a couple of reasons. One is I feel like we all have a responsibility to contribute to the knowledge in the field and to share that value across our organizations and our teams. I think that it also is a retention factor and an engagement factor, that if people are working on projects and solving problems that directly relate to their clinical practice and looking at research, it informs their clinical practice. It uses a different part of their brain. It gets them excited about doing something different and being published. And we always, make a big deal. We post it out on Slack. We, do all of that, and we really tend to celebrate it. We give people time. And I also think that, people enjoy the activity. And I think that has gone a lot, that has been secondary gain. Some of our students have published, actually, and I think that's been incredible. Many of those have actually stayed with us. And I think that that's really the incentive,
I like that. I actually found something similar in the VA. We have a new medical center director. I work across 3 sites. One of them, the medical center director, is extremely supportive of quality improvement and actually allows primary care teams to block out like a 1 hour. I forget the amount of time, but I think it's 1 or 2 hours every 2 weeks to do quality improvement. And one of the things that just observationally I'm seeing is that the burnout in the teams that are doing it, I think, seem to be less. I think there's potentially something there. It's been something I've been thinking about trying to measure in some way, is the teams who engage in that activity actually find that they value, like it somehow changes it up, like you were talking about, like it's a different activity, it's something different. And they value the fact that it's about improving their experience of work, like the quality. They get to choose the topic. He made a humongous deal about when, like a year after giving this time, they were asked to present. It was a huge deal. And really having that leadership recognition, I think, also fostered more involvement and engagement.
And I also think if you're a, senior leader and like, it's just not your jam, then there's probably someone on the team that would get excited about it. Let them roll with it, and empower them. And more I'm getting staff reach out and say, hey, I had this question, could this be a project? Or I heard about, this project at a staff meeting, and I would love to, be a part of it. So it's kind of getting a little bit more of a groundswell, which has been really nice.
Well, and we just had a conversation with someone the other day, a collaborator of Virna's, and she was asking this really pointedly, like, how do I make the business case to my chief operating officer to think about partnering with us to do research? And some of the additional things she and I talked through were, if you have engagement from staff and buy-in in data, does that improve the quality of the data that they're collecting in their sort of clinical engagements in ways that then overall helps to improve, like it makes it feel not just like, I'm just doing this because. And then the other piece was very much, she felt like research would need to be tied to cost savings or some metric that would be compelling or appealing to that person's perspective as the COO. And so trying to think through some different types of research designs and research questions that are about things like disengagement of care that could like whet the appetite of folks who tend to think more about dollars and cents. And she sort of, again, some of those were her ideas, some were mine. Just over the course of the conversation, it became very clear that there needs to be a business case in addition to the staff retention piece, which she also really felt like was important.
And she's a CFHA member too. Yeah.
Well, this is, any other questions about the specific content before we move to the discussion? I don't want to cut people off. So
Bill,
Okay.
did you want to ask your part too? I saw you had your digital hand.
Well, yeah, it's a very different
I
thing.
missed it.
The question is, so I assume, and this could be a very bad assumption, that clearly when it's a clinic specific QI question, and collection of data is simplified, and I'm not clear with Concert Health, when you have multiple clinics, and especially if those clinics belong to different systems or institutions, how do you, shall I say, expedite data use agreements, privacy, data sharing? Any tips of what you've learned in trying to overcome as quickly as possible some of those institutional collaborative barriers or barriers to collaboration?
You need to buy a drink for whoever's in charge of risk management at the organization.
Got
I mean, the project we work on in Montana with the Montana Healthcare Foundation, IVH, which is what we presented about last year at the conference, it's lots of different organizations and sites. And so we're having to navigate exactly this question. I've started to be really proactive with business associates agreements at the outset of the project. And then often medical systems have those. It's just trying to find the right lawyer. And if not, then we provide them with a template and it helps kind of move the process. But waiting, that's the only real strategy I've used that's been effective so far. And then we have like a really brief summary and overview of like our cyber liability insurance and some of the like back end stuff that then we proactively share with people, which again, those are the questions the lawyers are going to ask anyways. And so to just offer it in a like tight, concise package on the front end has built trust. And then one of the things we've tried to do pretty consistently is the like, on the back end, once an organization agrees, most of them don't have like data dictionaries. And so even if we get clinical records, then it's a mystery code and we don't have the decoder ring and it becomes a big puzzle. And so that's like been the other piece. We've been really intentional on the front end about engaging with conversations with folks who understand their database structure so that that process can happen in parallel with the legal agreements rather than like, so I don't know, those are just like some things we've used. Virna, other things to touch upon?
No, I think embedding in the BAAs and also Concert, owns the data. So that's been helpful as well. But I think it's been good to have a thought partner, that's been able to talk through some of those pieces as well.
Well, I have to jump off to another call, but thanks, Virna, for joining. It's nice to see you all. Have a good day.
Bye,
Thank you,
Brendan.
Brendan.
Thank you.
Well, that's a nice time for transition, I guess. So I guess I'm curious from the group. So CFHA, Virna mentioned a few things. We already do some things to help support. We do a lot that are targeted to a specific provider. So for instance, a lot of the rec has a track during the conference that providers who are attending the annual conference can attend to learn how to do research and engage in research, do program evaluation, quality improvement, how to read an article and understand it. We do a lot of things that are directed to a specific provider. We also do the evidence briefs where we send out a brief that summarizes in 1 to 2 minutes. It's meant to be read, summarizes research that's been conducted for in lay language to try to help members, again, individual members know how to kind of do this. But I'm curious if others have like ideas. So recognizing, Virna, all the things you just discussed and people who have listened to it, are there ideas of how CFHA's Research and Evaluation Committee could assist organizations? So at the organization level, so more at the higher like leadership level, continue to support program evaluation, quality improvement, and research within their organization? And are there strategies that people can think of that might be useful? And I want to say before Brandon left, he did mention one, which was, to be able to find articles, because members of the Research and Evaluation Committee may have access to PubMed or other journal outlets to get an article and share it. It's almost like a library. I guess Virna, I guess I wanted to ask, like, your first slide, which was, or maybe second, where you showed how you share the data behind choices you make. I guess I wondered about that. Like, that seems like it could take a lot of time to put together, to find all the research to support choices. I also know that in some settings, a lot of the choices may look the same, like suicide prevention, for instance.
Yeah.
There are some, was that something you think that an organization should just make for themselves? Is that one way that the REC committee could help, is if we looked at things that would be similar across organizations and like provide that? I don't know. It seemed like you guys really value that, or your people in your organization really value that.
Yeah, to be completely transparent, I had a master's student do that. So that turns out is a really great master's student job. But I actually do like the idea of figuring out, I don't know how we'd figure out, but some, processes or policies or things, maybe we poll people, we ask, I don't know, and then put them together, like, as a CFHA product, not that we're selling it, but like something that we're sharing, I guess. I definitely like that idea.
I agree. I think this is a really good start, and I'm glad this is being recorded so it can be lasting content on our webinar page. But something thinking through, like, for organizations or leaders that have an interest in research, but not necessarily the know-how or access to a research partnership, if we could find a way of kind of distilling some of the things that were mentioned on this call of, here are the things you need to think about, here's how you approach a business agreement, here's the financial argument you can use with your higher ups to support, you making this request for more research. I don't know if that would be most helpful as an additional webinar with a deeper dive, or an ELO at the conference, or even just like a PDF that we could pull together.
I wonder, it's hard when you don't have that research partnership. Like, it is, it's nice that you have Brendan, and like, that partnership exists. For those organizations in CFHA that don't have that, I would imagine it's very difficult. I don't know if anybody on the call exists in one of those organizations, but I would assume it'd be very difficult without that partnership. And maybe that's where CFHA could assist.
It could be. I was going to say maybe there's something where people, there was talk on the listserv recently, and maybe organizations could come together on a particular project and then share, a research partner.
And actually, this is making me think of something that came up during the planning meeting in Boise about the value of connecting people that have primarily clinical roles with people that have primarily research roles. And I think there's representatives in both camps out there, but we aren't doing a good job connecting with each other. And speaking as someone who's in an academic appointment, like it sounded like Brandon was, I don't understand fully his role, but maybe is more of a organizational researcher. As an academic, a willing academic partner, I would benefit from training in terms of how to approach those partnerships as well, like some of the things that he was mentioning about data use agreements. And it just seems like there might be an opportunity for the rec to facilitate those connections.
Yeah, and I'm not familiar with the diversity of the organizational members. Some academics, some are going to have different focus of their organization, and so it might be I'm real big on assessing what are the needs. So Virna, I mean, you and your group sound to be very well immersed. The culture is very appreciative of all of these issues and research. I'm not sure how universally that's shared across the organizational members, but it'd be helpful, I think, to understand more, what are the quote needs, the desires, what are their perceived their perceptions of what CFHA or collaboration could buy them.
Yeah, agree. I think I also run into a lot of people that would love to do some of this work, but it isn't supported in their organization. And so they would like to have a forum to do it. And maybe we give them that,
I'd like to add something from the researcher's point of view. As someone who's applied for grants and helped academic research programs together, one of the really big difficulties is finding clinical places to do the research. So I do think there's probably a lot of people out there who would like to help clinics do research. I don't know how we get them all connected, but if you want to apply for a grant, you have to have clinics. And even if you're in an academic center, your population is skewed. You can't just depend upon your population. So you have to reach out and find other partners willing to work with you. And that is really difficult.
Yeah, I think, I partner with other clinic organizations, not actually outside. And I know that when I ran health centers, all the academic folks were always trying to come to me with projects, and some were good and some not. But I think it would be interesting to get people, in clinical organizations who are interested in answering questions about their own clinical work or practice.
It goes back to that Aubrey's suggestion, that networking thing. I like that idea in the sense that there are potentially individual providers who would like to be involved, like in doing research, program evaluation, or quality improvement, have a question, but they can't do it by themselves. Their organization isn't supportive, but within the CFHA organization, they could connect with other groups of individuals who could, maybe they could do it together.
So might there be a rec sponsored activity or forum in Phoenix that could facilitate that? If you kind of think more about, trying to understand not only interest, but also then that, if not before, then that might be a forum where people can be asked, what would be most helpful for you to find out that would help your clinical kind of enterprise, that you find it more than challenging to do on your own.
It's always a possibility. And wrote it down.
Mm-hmm. I mean, we're glad to, to help. However, people think that we could be helpful or, with Brandon. So I think, if there's anything, and, we are not flush. And so, the ability to partner was actually, I think, not as much as people are envisioning, but certainly shared might be really accessible for people.
Well, even just your story, I think, so I would love to say like a business case would convince a leader to shift towards embracing a more of a positive attitude toward quality improvement or program evaluation if they weren't there yet. But I do think the story also is a valuable piece and often the foot in the door, and then the business case kind of solidifies it. And so perhaps even collecting stories like yours of the benefits from your perspective as a leader in the organization is just as valuable as creating the business, as a valuable piece of the business case that we could do, like kind of trying to, because I think sometimes they're just not knowledge. Like they hear the word research and they turn their ears off. And so, and it's not the thing that they're, in their position, they're hearing a lot about. So that could be another addition to do that. But well, I'm recognizing that I'm trying to end meetings 10 minutes before because I do virtual back-to-backs pretty much all day, almost every day of the week. And I'm recognizing some people are commenting about it and need to have to leave to go see patients and such. So I really appreciate the discussion. I think there's a lot of great ideas. If you have other ideas, feel free to email them to Aubrey or myself, and happy to take those to the Rec Leadership Council. The way that we're kind of proceeding is that you might recognize we have webinars every month. This upcoming month at the top of the chat is the May 25th one. It's on quality improvement in healthcare, and that is on the calendar in CIH's website, but it will come out via email as well for you to be able to register for it. What we're doing is each topic we're talking about, learning a little bit about, and then kind of identifying potential strategies. And then in the fall, we will identify, we might do some of the low-hanging fruit ones, as a colleague likes to call it, now, but as a volunteer committee, we'll kind of strategically identify which ones we're going to move forward more seriously in this upcoming year in the fall. So Virna, this was great. Thank you so much. And thank you to all the participants for doing that. And I hope you all have a great day.
Thank you all. Have a wonderful day.